I'm Bill Livingood. I direct the Institute for Health Policy and Evaluation Research with the Duval County Health Department. I'm here to talk about the study of asthma that was done in this community. Asthma is a severe, life-threatening disease, but in this community we do not have very much in the way of mortality related to it. We have great health care in our emergency rooms and in our hospitals that limits that mortality. But unfortunately, we're relying too much on hospitalization and on emergency room visits to care for the problem. That is one of the key findings of this study is that the emergency room use and hospitalization use are very high, and that results in a very high cost to this community. Of course, it's very costly to the individuals who suffer asthma attacks, both in terms of economic cost as well as the personal detrimental effects. Asthma can be a very frightening disease.
It's very scary when I can hear him breathing, and the wheezing starts, and knowing that's what's going to happen. You're laying in bed and you're asleep and you're awakened about this real loud sounding noise, and you're thinking someone else is in the house, and it's actually your child in the next room in the bed sleeping that's having a hard time breathing.
Very important other finding of the study is that it disproportionately affects parts of this community much more than other parts, and it affects populations in this community much more severely than other parts than other populations. In particular, the African American community is disproportionately affected, and although we don't have clear data as to exactly why that is. In fact, we don't have even good data as to what is causing the epidemic of asthma.
When he has his attacks, his breathing gets worse. I mean, he just keeps to the point that he can't breathe, and his chest is on the outside, going to pop out of his body. And he falls down to the ground and just says that it hurts so, and we try to keep the inhalers active. Current so that he can take it, and it takes us a while before we can get him calmed down, but a lot of time at night it's awful.
I've gotten used to some of it, but when the asthma attack really starts, it just kind of stings me, and I'm just hurting and screaming, asking for my mom, please give me my inhaler, please give me my inhaler, and just trying to stay alive.
This disease is a very manageable disease with good primary care, and that essentially means that people need medical support, a home where they can go to get that primary care. There are both treatments for acute episodes as well as treatments for chronic management of the disease so that you don't end up having acute episodes. And physicians, particularly physicians that are trained in specifically in asthma, can provide that kind of care.